All right, I'm going to go ahead and wash my hands before we start this exam. My name is Kirsten Batts. I'm a registered nurse, okay? And I'm going to be performing a physical assessment on you today, if it's okay by you.
Hi, Kirsten. My name is Jess.
Okay, great. And the consent is okay, yes to do?
Yes.
All right, wonderful. So this is for my nursing assessment and health class 1, and so I'd like to get started. First thing is I did get a list of your vital signs, 132/74, which is perfectly okay blood pressure, 68 heart rate, which is within normal limits, 97.7 temp, which is great, and 24 respirations. All of those are within normal limits, okay. Are you having any pain today?
No.
Okay, no pain. All right, so I'm going to ask you, how did you get here?
I drove.
Okay. Do you know what today's date is?
Today is October 10th,
Okay, great. What year?
2021.
Okay, what'd you eat for lunch yesterday?
Ham sandwich.
All right, great. I just tested your short-term memory. Totally intact. You were able to recall what you just had yesterday for lunch. You know, you're alert and oriented times 3. And so that's great. You present with a pleasant affect. And so I'm going to give you a list of 4 words. Don't be nervous. This just tests your long-term memory, okay, to see if you can recall these kind of toward the end of the assessment. So the words are bottle, picture, car, and giraffe.
Okay.
You got those?
Got it.
Okay. So at the end of the 20 minutes or so about that the physical assessment takes place, I'll ask you to recall those, okay? So the very first thing that I would like to start with is the physical assessment of what I see here in front of me, my patient, okay? So if you will take your glasses off and put them off to the side, I'm going to look at your head, if you don't mind me touching you. Your head is nice and round, normal cephalic. I don't see any lesions or abrasions or any kind of issues with your scalp itself and your head, okay? Hair is nicely dispersed. I don't see any receding hairline or any alopecia. Your hair is oily. And I don't notice any lice, nits, or lesions, okay? Then I'm going to look at your ears. They are nice and midline there. Your eyes are on the upper third of your face. Your nose is midline, and your mouth is in the lower third. So all of those are what us as nurses or healthcare professionals would expect to see. Nothing that's out of the ordinary. Now, your eyebrows are nicely dispersed. They're even. I don't notice any kind of scaling or abnormalities in it. Your eyelashes are everted, which is good, and they're thinly dispersed on the bottom and a little thicker on the top. You don't have any redness or drainage or any kind of eye problems that are apparent to me. So I'm going to grab my pen light. I'm going to look in your ears if you don't mind.
Okay.
Great, thank you. I don't see any excessive amount of serum buildup or wax buildup. The ear is normal in shape, no lesions or cuts noted. And then I'm going to look on this side as well, and same for this side, no wax buildup. Now, if I did have my otoscope, I would open up, take a look, and I would do that by pulling the ear back, putting it in here, and I would be looking, it's okay, you can look for it, I would be looking for the concaveness of the eardrum, and it's going to be like a kind of a pearly white, okay? Anything out of that normal, then there might be damage to the eardrum. I do know that Jess does have some hearing loss in this right side. That has been reported on his physical history as well. Okay, so the next thing I'm going to look at is your nose. If you'll tilt your head up, everything's normal. I don't see a deviated septum. I don't see any obstructions or blockage. He does have nasal hair, which is great. You can tilt your mouth. I'm going to look at your mouth. Open wide. Okay, buccal mucosa is pink and moist. Tongue, can you stick that out for me? Is intact. Teeth are all intact with no cracks. Does look like you have some cavities that have been filled and a few crowns in there. That's pretty normal. You do have some facial hair. I don't notice any scaling or any type of scab buildup, and well trimmed. Overall, your skin at first glance is intact. I'm looking at your neck, your ears, your face. Let me see your hands. All of the skin that I see is intact. Okay. On your fingers, your fingernails are intact. There's no pernickiums. There's no tearing. Capillary refill is less than 3 seconds. There's no clubbing, trimmed and neat. And I also would look on your toes to make sure on the nail bed that's less than 3-second capillary refill. I would be checking for swelling or any type of abrasions or bruises on them, but all of that checks out. Now, on your skin overall, on your face, I do see a few nevuses here. The brown spots looks like some sun exposure. So do you get out in the sun a lot?
Yes.
Okay, just remember when you're getting out in the sun to wear your sunblock. That will protect your skin from skin cancer.
Okay.
I also noticed on your skin, you do have these little hemangiomas, little red spots here, one right under the chin and one on the other side. And those are birthmarks from birth, correct?
Correct.
Okay, great. All right, so I think for this next portion, I'd like to move on to testing of the cranial nerves. I kind of like to separate that out and perform that as opposed to trying to go back and forth in the physical assessment with that. It just keeps me on track and a clear vision. So the very first cranial nerve that we're going to test is cranial nerve number 1, and that's olfactory. Okay, so I have got something that I'm going to let you smell, and I want you to let me know what you smell.
I smell vanilla.
Okay, great. So cranial nerve number 1, olfactory is intact. That is vanilla. Okay, so for the next test, that's cranial nerve number 2, optic. We're going to perform 2 tests. Okay, so I'm going to have you stand up for me. Okay, perfect. Yeah, and just stand just about like that. I'm going to stand about an arm's length away. And this will be checking for your peripheral vision, okay? So I'm going to have you take your right hand over, yes, your right eye. And then what I'm going to do is I'm going to be placing a finger, okay?
Okay.
And I want you to tell me, I'm going to place it low, mid, and high, and I want you to tell me what you see, okay?
2, 1, 3.
Okay, take this arm down and go ahead and do the left eye. Okay.
3, 2, 1.
Okay, great. Awesome. That's wonderful. So that portion of the optic nerve, cranial nerve number 2, optic, is intact. For the next portion, yes, great. I'm going to have you put your glasses on. I did download a Snell test. And so I'm going to have him read from here. If a patient does have glasses, that you always want to make sure that they have them on for this. So I'm going to hold it, at about 20 or so. No, it's about 20 feet away, but not 20 feet away, but a good distance away. And what I'm going to have you do, the goal of this is you're going to cover your right eye, and then you'll be doing your left eye, and then you'll be looking at it with both. So covering your right eye, go ahead and read the line, the lowest line that you can read.
DEFPOTEC, line 8.
Okay, great. Go ahead and remove your hand. Now place your hand over your left eye and go ahead and read the line that you can.
DEFPOTEC, line 8.
Okay, great. Now, go ahead with both of your eyes and read the line that you can.
LEFODFCT, line 9.
Okay, great. So we just now checked. You have 20/20 vision. Go ahead and have a seat. The first test was the peripheral, and that was intact. The second was the acuity, the Snell test, and he passed both of those 2020. So we know that the optic nerve is intact. So the next three that we're going to do is cranial nerve number 3, 4, and 5. Okay. So we've got the ocular motor, we've got the trochlear, and the abducens. Okay. Might not have said that right, but that's close enough. So for this first one, I'm going to grab my pen light, and all I want you to do is just focus on this, on the pen light itself. I'm going to move this in the 6 cardinal directions, and to see if there's any kind of nystagmus or shaking or movement of the eye, okay? Okay, great. Ocular motor, cranial nerve number 3 is intact. I did not identify any nystagmus noted, okay? So on the trochlear, what we're going to do is, in this one versus the abducens, we would actually dim the lights, but I'm not going to do that because you might not be able to see it on camera, but we would dim the lights, have the patient focus on, an object out behind us, okay? And I'm going to introduce my pen light. And the purpose of this is to notice if the pupils kind of constrict. So if you have somebody that has pupil size of 3, you would want them to constrict down to 1. And we're looking for the equalness of that as well. Okay, so just look straight ahead. Okay, restricts nicely. All right, so both sides constricted normally. So we know that the trochlear cranial nerve number 4 is intact. The last one, the abducens, okay, is checking for accommodation. So what we're going to have you do is we're going to have you focus on the pen light, okay, and what we're looking is for those eyes to cross and to constrict as he focuses and tries to accommodate his vision to this pen light. And absolutely, they did constrict, and he did cross his eyes trying to track and follow this. So abducens, cranial nerve number 5 is intact. And so we know this to be pupils are equally reactive, round to light and accommodation. And that's how, as a nurse, you would chart that, and that's how you would test it. So then moving on to cranial nerve number 6, this is the trigeminal nerve, okay? So this is the nerve that's involved in mastication, or what we normally call eating, okay? So I'm just going to have you bite down, okay? And I'm going to be feeling the temporal and the masticant here, and that's nice and firm, okay? So I do know that that is intact, but what I'm going to do is I'm going to have you open your mouth not yet, sir, open your mouth when I put some pressure on it. So resistance. Now open your mouth. Awesome. Okay, cool. So cranial nerve number 6 is intact, and that's the trigeminal nerve. The next one, or cranial nerve number 7, is the facial. So I'm going to have you close your eyes really tight. Okay. Now open them back up. I'm going to have you smile. I'm going to have you frown, and I'm going to have you puff out your cheeks. Okay, great. So cranial nerve number 7 is intact. Moving on to cranial nerve number 8, which is the vestibular ocular, okay? And the purpose of this is I'm going to occlude one side, and I'm going to whisper, and I hope that he will be able to hear what I've said.
Banana, apple.
Okay, great.
Muffled, but I can't understand it.
Okay, so for this side, I did say cat, dog. He heard. So that cranial nerve number 8 is intact. He just can't make out what exactly I said, and I said cat, dog. So cranial nerve number 8, vestibular ocular, is intact. Cranial nerve number 9 is the glossopharyngeal. And so this is where I'm going to take a look. What I'm looking for is the uvula to move, okay? And I'm also then going to elicit a gag. So when I press down with the tongue blade, I want you to say ah. Perfect. Uvula moves up and down, a little bit around, so that's great. Okay. Sorry about that. Okay. Cranial nerve number 9, glossopharyngeal, is intact. Cranial nerve number 10 is your vagus nerve, and that's intact because he's been able to speak with me with no hoarseness, and he's able to swallow, so that I know the vagus nerve is intact. Now, cranial nerve number 11 is the accessory. So what I'm going to do is I'm going to push down on your shoulders, and I want you to shrug up. All right. Cranial nerve number 11 is intact. Cranial nerve number 12 is the hypoglossal, okay? And so I just want you to stick your tongue out and then move it side to side. Okay. Cranial nerve number 12, hypoglossal, is intact. So all your cranial nerves are intact. All right. Could you recall for me those 4 words?
Those 4 words were car, giraffe, bottleneck fisher.
Okay, awesome. Pretty good. Now, the next thing I'm going to do is I'm going to palpate your neck for any swollen glands. Okay. And of course, if I was doing the assessment, I would walk behind and I would palpate. You can turn a little bit. I would be feeling for the thyroid to make sure that that is not swollen. So the next portion, of the exam is I'm going to listen to your lung sounds. Ideally, you would have a patient that had a gown on that you could slip under and listen, but you're going to be listening. Deep breath in and out. To the other side, directly opposite, in and out. In and out. And again, in and out. And then way down on the side, in and out. And one more time there, and out. Now on the back, if you can kind of turn this way a little bit, when you're listening on the back, of course, I would, I'm not going to do that. I'm not going to take his shirt off, but I'm going to listen here underneath the shirt, but for the purposes of the video, just trying to show you. Take a deep breath in and out. 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 And last one, in and out. Okay, you can turn yourself back normally. The only other last thing I would do is I'm just going to listen to the patient breathe regularly. Go ahead and just breathe normal. Okay, sounds great. All lung fields were clear. I didn't hear any crepitus, rales, rhonchi, any kind of wheezing, bilateral throughout. All were clear. Okay. So that's great. Now the last portion of the assessment is going to be a breast exam. Now, excuse me, I'm not going to be doing a breast exam on you, but you can turn yourself to the side and I can use you, turn that way if you don't mind, just to kind of show. If I would have a patient, male or female, both need to do this, I would encourage monthly breast self-exam. And excuse me, basically you would do this. You would have the patient lift their arm up, okay? And you would want to start at the talus spins. This is where most tumors are found, and that is really important to start there. You would start with light palpation and move to a little bit more firm and inch by inch covering, okay? So if you want to just raise your arm, put it behind, you would start here and you would palpate down and then around the breast all the way circular, and not big gaps in between. So here, around and around and around till you reach the areolar, And then you're also going to pinch and make sure there's no discharge. You can go ahead and put your arm back down. The nurse also, assessing patients, would have them remove their gown, and you would want to take a look at the patient's breasts and see if there were any abnormalities, any kind of tucking, any kind of dimpling, anything that would look abnormal. Now, the actual physical touching exam of the breast, you always have the patient lay down. And like I said, you do one side with the arm up and relaxed, and then the other side with the arm and relaxed. But that's an important thing for them to know how to do it themselves monthly. And then, of course, a yearly checkup, that would be great with their female doctor for females, and then men can have that done with their yearly physical exam. So, do you have any questions?
No.
All right, it's been a pleasure, and I thank you for participating.
You're welcome. Thank you.
Thank you. Bye-bye.